Since 2020, the COVID-19 pandemic has washed over the entire planet. Its impact in Europe alone caused over 1.5 million deaths and almost 90 million cases to date. By hitting our healthcare systems with unprecedented force all across Europe, the pandemic generates pressure on hospitals and medical professionals as millions of patients seek urgent care and answers. Meanwhile, policymakers at both European and national levels are entrusted to find prompt solutions and regulations. Today, as another COVID wave sweeps through Europe, it escalates an alarming number of questions on the state of our healthcare systems and on their readiness for other pandemics in the years to come. First and foremost, to protect all patients. In fact, one of the main cracks highlighted by the pandemic was the difficulty for patients to effectively be in touch with their healthcare workers, thus putting at risk not only COVID patients, but also those who are requesting treatment for other symptoms, diseases and infections.
It was very, very difficult for the patient who suffer from chronic diseases. They are not able to receive their treatment. Also, it was very, very difficult to went to the expert centers. Many of them lost the contact with the expert centers.
Second, how to protect those on the front line. Patients are not the only ones under pressure. Since the beginning, healthcare professionals have been the shield between the virus and society. Intensive care doctors and medical professionals are the last line of defense against the onslaught of the virus, but the first ones pressed to find rapid answers.
At the beginning, it's been a major challenge, especially because it was something new, unprecedented. We had to surge so many ICU beds because we wanted to care for every patient. It's important to remember it's not just COVID, it's every patient that needs critical care, high-intensive care.
A dramatic lack of staff and personal protective equipment revealed how stretched our systems were already before the pandemic. With this burden of awareness at the heart of the EU, policymakers of the European Commission work at full capacity to cope with the crisis and propose a solution. 2 years after the initial outbreak, among the many lessons learned, one seems the most vital to remember.
We think that the strengthening of the European Health Union is not an empty phrase. It's something which brings benefit to everybody, small countries and big. We have legislation in place since 2013 dealing with cross-border threats to health. But I think the experience with this legislation during the current COVID outbreak has shown us that the certain aspects of the legislation need to be strengthened.
The pandemic has provided an opportunity for many lessons to be learned in relation to EU response and preparedness. EU policymakers look back to understand what could have been done differently and what didn't go as planned. Because what has been labelled the greatest crisis of the century taught us a hard truth.
The moment our healthcare systems collapse, the whole society collapses. So first and foremost, international cooperation. That's one of the biggest lessons to learn. We cannot take individual measures because it makes no sense when we're dealing with a virus that sees no country borders. Second is the One Health approach. The concept that the environment, the human health and animal health are all interconnected. And it's already contemplated in the EU for Health program, which is the health program for the European Union from 2021 to 2027.
The pandemic had a profound impact on the perception healthcare providers and patients have of the EU and its role in health. In which areas should the EU act?
It will be the digital health. The pandemic showed us that we need it, and we need it now. I think that the European Union must start to think that After the pandemic, the biggest difference between the richest countries in the European Union and the poorest, it will be a great problem.
We need to create a way for a system to be a bit more flexible, but also it would be a mistake just to focus on hospitals. We are the last line of defense. We need to build this resilience also out there in the community, maybe with more public health measures. Concepts like the European Health Union or the development of agencies like HERA are going to be milestones for healthcare in Europe in the future.
While medical professionals and civil society are calling for improved cooperation on health, EU decision-makers are facing obstacles in making this a reality.
The situation of the member states' health systems is different from one to the other. There are different traditions, different organizations. The national authorities decide how their systems are going to be organized. In the European Union level, we don't necessarily have a dialogue with all of these regions, particularly in a crisis situation. The European Union has a health union, which has different components, a legislative component on cross-border health threats, but also strengthening of our two agencies who are mostly concerned, the ECDC and the European Medicines Agency.
What we have at the moment, what the legislation says, what the treaty says is provision of healthcare is a national competency. However, protection of public health is a shared competency between EU institutions and member states. So yes, it is politically feasible to have a true European health union.
The EU plans to invest €5.1 billion in the EU4Health programme. This is a historical turning point for the Union, considering that the previous 2014 to 2020 budget was just €449 million, a mere 10% of the current one. A recent survey suggested that 61% of EU citizens believe that more decisions should be taken at European level when dealing with health. And many would like to establish a true European health union where more is decided by Europe. This hands us an opportunity for stronger collaboration between member states and EU for better health outcomes for everybody in Europe.